Ashleigh, welcome to Pregnancy and Birth Diaries. Let's get started from your pregnancy. What was it like? Was it a planned pregnancy?
It was planned. My husband and I had been married for about we got married in 2014 and she was born in 2017. I mean, it started off normal. I do have a condition called antiphospholipid antibody syndrome, and it is a sort of a autoimmune thing. So that's why I had a first miscarriage, because I did not know that I had that. So during my entire pregnancy, which only lasted into the second trimester, I had to take blood thinner shots to keep my pregnancy viable. So everything was normal. I felt fine. I was never nauseous or anything like that. Around 25 weeks, I started getting severe pain in my upper right quadrant, and I just thought it was like a normal pregnancy symptom because I had never been pregnant before. Well, not a lasting pregnancy. So I just kind of brushed it off, and I went to the doctor. Well, my gyno, I actually worked right next door at the cardiology office. So I went in on a Friday, and he kind of just brushed it off and was like, "Yeah, you probably just are growing pains and blah 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 blah." And he was like, "Just come back on Monday if you're still sick, or if you still don't feel good."
But what
So,
was the specific, what were you exactly feeling at that point?
It felt like I was being stabbed in my upper right quadrant, which is where your liver is. I felt a little better over the weekend, but then Monday I was at work and I couldn't sit down at my desk because of how much pain I was in. And so I got up and I walked next door. They did some blood tests because my doctor said you shouldn't be feeling this you should not be in this much pain in at all. They did not know this at the time, but I was having full blown contractions. And so they did blood work and they sent me home for the rest of the day. And I guess when my blood work came back, I had gone and taken a nap. I actually threw up on myself on the way home, driving myself. And I mean, I felt like I was dying. And then I get home and I take a nap. My husband was going to go to the chiropractor, but he ended up not going because I woke up from my nap and I had like 5 missed calls from my doctor's office. So I didn't even call them back at first. I called my husband. I said, "They've called me 5 times, so I'm assuming it's not something good." So I called them back and they said I needed to get up there right away. I was in full-blown kidney and liver failure, and I ended up getting this conditions kind of like not postpartum, you know what I'm talking about, preeclampsia, but times a million. And it's a 1 in like 500 million chance of getting it, especially in the second trimester. And I also had so I had HELLP syndrome, and then I had APS. So I was on blood thinners, so I couldn't get my C-section like immediately. But I ended up getting a C-section, and she spent 91 days in the NICU. She was 1 pound and 10 ounces at birth. It was very touch and go, but thankful she is very, very healthy. And since she was in the NICU, I never went back to work because I wasn't putting her in daycare to get repeatedly sick, as fragile as she was, because she had premature lung disease and came home on oxygen. But long story short is she's perfectly healthy now. Maternal fetal will not see me because of the APS and the HELLP syndrome in the second trimester. If you have 2 of those together, I've tried to have an appointment, and they basically just wanted to use me as like a science experiment, and that's fine. I was 26 when I got pregnant. I had her when I was 27, so I wouldn't have to go there, but I got repeated pregnancy, which they advised me when I woke up from my C-section that I should not have any more children because I'd be risking my life. And obviously, that's not worth it because I have one beautiful daughter. I never wanted to have an only child, but you don't get to pick sometimes. And because I'm one of 5 kids, and my sister and I are best friends. We talk all day, every day. But that's pretty much it. Recovery wise, I was pretty numb. I still suffer from PTSD from it. Just everything was just in such shock. I was like very numb. I mean, coming home from the hospital after a C-section with no baby and having your baby at the hospital and neonatal intensive care for 3 months. I wasn't able to hold her for almost an entire month. So yeah,
Wow.
it's pretty traumatizing.
Yeah, I actually didn't even know about that. So if you have a baby who's born preterm, then they are placed in an ICU, right? How did
Yes.
and then you don't even get to see your baby or
No,
hold your
you get to see your baby, but the baby stays there, and there's NICU nurses who I'm very good friends with, a few of them that help save my baby, and I'm very thankful for them, and I'm thankful that I had gone to a new doctor because the other hospital that I was first going to, where I had my miscarriage, they did not have a NICU, so she would have had been transported. And that causes brain bleeds at that age, and or because they're so fragile. Actually, my husband's wedding ring or his wedding band fit over her wrist,
wow.
like her, yeah. So, I mean, you could put her in the palm of your hand. So she didn't have to be transported. She's literally just a miracle. Like, she is extremely healthy, tallest kid in her class.
Wow.
She's beautiful and she's funny, and I know I would have been devastated because I wouldn't have had to be, if something would have happened to her, I would have not had another one. I couldn't have another one. So,
Yeah. I'm
but
really glad to hear that this has a
you
has
just advocate for yourself, because that doctor just kept trying to push me off,
the
and
first
I kept telling him,
too.
no, that not the first doctor.
Oh,
The doctor that was at the practice that I was going to. He wasn't actually the doctor that delivered her. It was a different doctor on call.
yeah. Was there any I don't know, they didn't check why it could have happened? How was it not noted?
Well, they well you don't get you can't get checked for help like that. You just develop it, kind of like preeclampsia.
Oh, okay, because you already had kind of like underlying condition and then it got
Yes.
worse because of the pregnancy. So
Yes.
it kind of manifests only during pregnancy, but like if you're not pregnant, you don't have any specific symptoms?
Correct.
Okay.
So, just because statistic wise, if you have that condition that I had, and I mean, the doctor did do blood tests, and that's how he found out that I had APS because of my first miscarriage. Um, and then that's when I changed doctors, and I told them that I had APS. So he was like, "It's normal. People are on Lovenox all the time." Which is a blood thinner shot that I used to have to give myself in my stomach. Um, it'll be fine. And he just, I don't know. He only did blood work on me when I was complaining that I felt like I was. He said, "How do you feel?" And I said, "I feel like I'm dying." And I was. I was in liver failure, kidney failure, and they said if I would have went to sleep that night, but not having her, I would have had a seizure in my sleep, and probably would have both been dead.
Oh my God.
So, I mean, it's pretty traumatizing.
Yeah.
Yeah,
And so, but if you didn't have that, then you probably wouldn't have this kind of kidney liver failure because APS is not on its own dangerous.
it is. It's a blood clotting disorder, and it's kind of like your body tries to fight off the baby, like clot it up so it breaks off the supply to it. It's just autoimmune thing. I don't know. Apparently, a lot of people have it. A lot of people have to be on Lovenox, but I've never.
Yeah,
I don't
but
know.
you can have a safe pregnancy and childbirth, right? With both.
With APS, yes.
Yeah. Okay. Okay. It's just that the health condition was not known, and then that's why your doctor kind of missed probably the complication that it led to.
Yes.
Okay. Um. So then, can you tell me more about how was those 90 days when your daughter was in ICU?
So I actually went home for 6 weeks for my
Recovery?
yes, for my recovery. And then I actually worked down the hallway as I said, in the cardiology office. So I would go in the room there and I would pump my breast milk and then I would walk it over to her and they would feed it to her and put it in there. She was being fed like through droplets and then she had a feeding tube and I mean she was on they have different machines for different types of the breathing and the oxygen and they are one of them's the jet, and that's traumatizing to see your in tiny, tiny little baby having their chest shaking, being to breathe for them. And but I didn't get to ever. I only breastfed her about a handful of times because it was just easier to pump it and give it to her. But she was on a NeoSure formula mixed with my breast milk because it added extra calories
Mm.
and it's made for premature babies. Um,
When she was born, how much did she weigh?
1 pound and 10 ounces.
And when she was and when you
She
left,
was 26 in 3 days,
wow.
but she came home on oxygen. But I would go and see her daily. I think I missed one day that I couldn't see her. But you go in there and you can only have 2 people at a time. So and you have to set a timer and scrub all the way up to your elbows for 3 minutes before you're allowed into the rooms. She did come home on oxygen, so I had to.
What is it? Is it like a special?
No, it was just like a nasal cannula.
Oh, oh, okay. And when did
But
you remove it?
when she graduated from the pulmonologist, which took
Oh,
about a year
oh, wow.
for her
Which,
lungs to properly develop.
okay. So when did it properly develop? When she was around 1 year old?
Yeah, so she would have been technically so when she was 1 years old, she was technically 9 months adjusted. So she was the size of a 9-month-old baby, but she was technically a year old. I literally just look at her and you cannot tell that she wasn't a perfectly healthy baby. And like she is 6 years old and she lost her front tooth and she's losing her teeth now and she was really into getting dressed in her fashion and actually today she wore a little Halloween outfit and she put red cowboy boots on. I have no idea why, but she is something and I'm very, very thankful for her. They did a remarkable job taking care of her. I mean, some of them still come to her birthday parties.
So how about you? How did you recover? Because you were in a very, you know, dangerous condition when you gave birth. How?
After you give birth with that, it goes away.
Oh, wow. Okay.
So I
Interesting.
didn't need anything. I don't have any issues with my liver or kidneys or anything like that. It was literally like I did not ever think that this could happen. I had no idea what it even was at first, but I've been in groups that say like a group of people, other women that have had the same conditions as me, and you just see it's heartbreaking, but a lot of it comes out good. And I had a girl close to us that I had never even met before, but she knew several of the people that I knew, and she actually had a baby 2 weeks earlier than I did, a couple years after, from the same exact condition. So I think her baby was in the NICU much longer than Corbin was, and she has eye issues and she's had to have surgeries. Um, but she's sweet and she's home, and she, I mean, it's heart-wrenching, and she also knows she can't have another child. So, but I talked her through her whole journey, and definitely eye-opening, and I'm glad I'm still here because
Yeah.
my brother had passed away a couple of years ago, and I would hate for my mom to have lost 2 kids.
If your doctor, for example, established that you have this condition before you started having kidney and liver failure, do you think it would have been able for you somehow medically prolong the pregnancy?
More than likely, no, but I would have been able to receive shots um, to help her lungs develop better. So
Oh,
that was, I was angry about that, but she does not have any issues with her lungs any longer. Yes, but I mean, I went into emergency C-section. I got to that hospital and they took me to labor and delivery like that, and I was like, "What in the world is going on?" Like, and I remember the doctor. I mean, they were like freaking out, trying to put me to sleep, and it was just really scary. I woke up and I had a baby. I do not know what I would have done without my husband.
I know that in US you have health insurance. Is this something
Mm-hmm.
that's covered by your insurance? I can imagine the bills.
I did have health insurance, and I worked for that same hospital. So I believe my delivery was about $3,500, so $3,500, and which really is not that bad at all because of everything. But in the United States, if it was created, Medicaid was created for certain things like this, where like any baby under 2 pounds or 2 pounds 13 ounces, all of their medical bills will be wiped clean because they are covered under Medicaid, which is basically wipes out all of their bills. So otherwise, that we would have been millions and millions and millions of dollars in debt. I mean,
Really?
she was there for 3 months. So, and all the different medicines, all the different specialists that would come in and see her, and nurses know specifically when they flip them on their sides and both sides, so their back of their head doesn't get flat. I mean, they're trained beautifully to do that, and it takes a special breed of person to do that because I know they see a lot of babies not make it, and
Yeah,
uh,
it's definitely telling to be doing that kind of job.
um, yeah, but I mean, I couldn't do it.
Yeah.
And
So
now I'm just a stay-at-home mom. I'm happy with it. Um, I have a beautiful life and a great marriage. My husband and I have been married 9 years, and we have Corbin, who's 6, and we get to do all kinds of things fun with her because we only have one, and they are expensive.
yeah. So I'm glad that you didn't end up having millions and millions of
Yeah.
dollars in debt because that sounds crazy. But the trauma, like you remember and you just, you have this feeling. How, but in your case, I'm thinking in your case, it's so much more. The PTSD that you mentioned, I think is so much bigger. How do you cope with that?
Medication.
Meditation? Yeah.
No, medication.
Oh, medication. I thought meditation. Okay.
No, and I get out and exercise because, yes, I was angry at the world for a very long time, especially my doctor. And when I was in recovery on the labor and delivery floor, he was the last one to come and check on me.
Mm.
And he put his head down, and he came in and was just like, I was just seeing how you were doing. And I said, I told you I was dying. And he put his hands in his pockets, put his head down, and walked out. But I wanted him to know, like, you almost killed me.
The first time when you went saying that you have pain and
Yes.
you're dying, yeah, and he said just brush it. He brushed it off and said, "Come back later if it keeps, if
Over the weekend, yeah. And I have an extremely high pain tolerance, so I'm not a wimp at all. Like, so, but he just brushed it off. And
also the place that you're saying that the upper part, like right hand side and upper side, I don't think it is like a normal place to feel pain during
he
pregnancy.
thought that she was just getting cramped up and under my stuff. Like she was just pushing or something because I don't know. But I could tell now that I look back on it that I was starting to swell because I had several people, like I said, I was on in the second trimester, asking me if I was having twins. I had one picture, I look like, because I was a rather small girl, I'm tall, so I carried it well at first. And then all of a sudden, you could just see, like a week later, I'm starting to get my ankles are swelling, all that. And that kind of is an indication of like preeclampsia and all of that. But
Stomach was bigger as well. You said others saw that as twins. It your stomach as well because it's 25th pregnancy week. You shouldn't be getting that big, right? It's just
right. And that's why people were like, you sure you're not having twins?
okay. All right.
Because I was
No.
larger than I should have been.
Yeah. That should have also been like another kind of like a sign.
Mm-hmm.
Also, like, is it something that you can see in the ultrasound, the kidney
No,
liver failure? Only blood?
no, it's all blood test. Yeah. I should have had my blood test when I first complained, and he could have prolonged it and let me get shots for her lungs, but I wouldn't wish what happened to me on my worst enemy. There is no way that I'm ever going to be able to have a child, is what I know. So, would I have loved to have 3? Absolutely. But it's just the way it worked out. And I don't know why it happened to me. They don't know why it happened to me. And I guess growing up, I was never like a sick kid. I never like got the flu. I never had chicken pox, nothing like that. But I would always get these really rare things. Like I bruised very easily. And my parents had me tested for leukemia because of how dark my circles were under my eyes as a child and how easy I bruised. But that went away. And I mean, I still bruise easy, but so that was that. And then I was in middle school, about 7th grade, and I developed these like lesions all over my body. They weren't itchy or anything. They were red dots all over my torso, on my arms, nowhere else, just my torso, my front and my back, and on my neck. I actually have a scar for where they did the biopsy to send it off. And it was this really, really rare thing called pleva. They didn't hurt, they didn't itch, and they were red, and then you had to let them heal and then you could tan them away. So it was just a really, really, really odd. And now, after that really rare occurrence in my pregnancy, I have recently been diagnosed with epilepsy. I just got it. I just got diagnosed last September. So last September. So that's the appointment I was actually at, was checking in with my neurologist. She said I can go to the yearly checks now, not every 6 months. So that's good. It's been over a year since I had my last seizure. But that's just, I don't know if that's what it is, but I don't know. But I've always just had really, really rare things happen to me. So I don't know.
So now, having gone through what you have gone through, and you just mentioned that you know someone else who had gone through something similar, what can you advise?
I would definitely say always advocate for yourself. You know when something's wrong. You need to make sure you're heard. Obviously, doctors can sometimes do that. You know, a lot of doctors, not just him, but I know several doctors that will just push you off and be like, "No, it's just a cold," or "It's oh, you're just doing this. You're fine. You just have a sinus infection," or you know. But you know better than anyone. So, especially when it's you and your baby, and I had already lost a baby, which I mean, in retrospect, everything happens for a reason. I know because if I wouldn't have had my miscarriage, I wouldn't have my daughter. I don't know the other baby. I didn't even get to find the ginger. I'll meet him again or her again one day, I'm sure. If you think something's wrong, you need to advocate for yourself because I'm glad I did. Otherwise, it would have been a way worse outcome.
Thank you so much. Is there anything that you would like to add?
I mean, I'm still healing, so.
Yeah.